This is Jefferson Close-Up. I'm Carol Celine. My guest today is Dr. Nancy Lewis. Nice to have you here. You have a great deal of varied interests. Talk about some of them.
Well, I've always been an avid reader. I love to read mystery novels and certainly the old lawyer novels and medical novels and things like that. And right now I'm interested in reading about the history of cancer, some of the things that they don't really teach us as we're becoming oncologists. There's an awful lot to learn about the history.
Absolutely. And what besides reading?
I'm a relatively new scuba diver. And I've been scuba diving in Belize and Hawaii, and I have an upcoming trip planned for the Cayman Islands.
Oh, that sounds wonderful. Oh, well, you're a nice, well-rounded woman here. What led you into medicine?
Well, I was interested in science from the very beginning, and way back when I was an 8th grader, I had done a report on cancer for my biology class. So my interest in cancer actually started at a very early age. I thought that I would ultimately become a laboratory scientist, so my undergraduate degree was in microbiology. But during my college years, I ran first aid at Penn State, and I really enjoyed being with patients. So rather than graduate school, I went to medical school.
Now, your specialty is medical oncology with a particular emphasis on GI cancers. What do you like about what you do?
Well, on a day-to-day basis, my job is very varied. Not only do I work with cancer patients and develop treatment plans for them, but I'm also interacting with pharmaceutical companies and looking at new clinical trials for newer agents that may be more efficacious and less toxic. I think it's very important that patients have access to brand new drugs, and frequently they're only available through clinical trial participation. And I know that a lot of patients are frightened about perhaps getting a placebo, but that's a very, very uncommon thing in cancer clinical trials. Most of the time patients are getting new drugs that are showing a great deal of promise in the laboratory.
Tell me a little bit about how you approach patient care.
I look at myself as a partner in the patient's fight against their cancer. I like to think of myself as an advisor to help them make the best treatment choices for them and to help guide their treatment decision making. I'm also it's also very important for me to help manage many of their side effects so that they can get through treatment as easily as possible. But again, I view myself as a partner in their care.
Cancer care is often looked at as a team approach. Is that the way it's done here at Jefferson?
Absolutely. Many of the cancers that I actually treat, including gastroesophageal cancer, colon cancer, rectal cancer, pancreatic cancer, and liver cancer, are what we consider multidisciplinary cancers. So I interact quite frequently with specialists in radiation oncology, surgery, organ transplant, as well as some supportive ancillary staff like an excellent nursing staff, nutritionists, and things like that.
Well, it's easy to see why you find your day so interesting. Thanks for coming in.
Thank you.